Guys know Dr. Soriano, who worked with me over on Holloman. This is his son, and he has his master's in public health and has been doing research for a year now?
3 years.
3 years. Oh, we graduated
2 years ago.
okay. I can't believe that was 2 years ago. And so he's going to be talking to us about heart disease and what it is, what we can do about it, how we can avoid it, different things like that. So I'll let Anton introduce more of what he's been doing, and we're excited to hear what he has to say.
Thanks.
All right, thanks, Anton.
So do I just call you whenever I need
Yeah. Ding or something.
Okay, sounds good. So hi everyone, again, my name is Anton Soriano. Just a little bit about myself. I grew up here in Bryan College Station for most of my life. Again, both my parents are doctors. One of them being my dad, Anthony Soriano, he worked with Dr. Imperial, and also my mom, Maria Cristina Soriano. She actually worked right across the street in that green awning as a pediatrician. So big background in medicine, and I'm super excited to share some information about heart disease for you guys as well. Just a show of hands, does anyone have any complications related to heart disease, or like hypertension, diabetes, obesity, anything related to that? Okay, cool. So this presentation, kind of just going over housekeeping responsibilities, so we'll be talking about some of the...
No.
Oh, okay. Some of the basics related to heart disease, some of the risk factors, causes, and then also we're going to be talking about what I like to say is a lifestyle prescription. So focusing more on prevention, treatment, and then also reversal. And this exactly, I'm referring to what you can do in your own lives that aren't necessarily related to medical treatment or medical prescriptions directly. Okay? Okay, so what is heart disease? So heart disease is kind of an all-encompassing term and condition that describes a variety of problems related to the cardiovascular system. Now, the most prominent being coronary artery disease in the first one right here, which involves a narrowing or a blockage of your arteries located in your heart. There's also cardiomyopathy, which deals with the disease in the muscles of your heart. So think if you have a diseased muscle, it's kind of harder to pump blood throughout the rest of your body. Then we also have arrhythmias. Arrhythmias you can kind of see the word rhythm in it. So if you kind of think of irregular heartbeats and the rhythm of flow of blood throughout your body. So many of these symptoms relate to a term called atherosclerosis. I have a hard time saying it, it's a big word. But essentially, the best way to think about it is just from this picture here. I don't know if everyone can see it with the glare, but you have a buildup of fat and plaque that goes through your arteries. So as you can see, like over time, this open area is where blood flows through, right? If you have a buildup of fatty plaque right here and right here, over time, that area where the blood needs to flow through gets harder and harder to go pump throughout the body. So we want to try to avoid getting this fatty plaque or even trying to reverse it, but I'll talk about that later on too. So some other symptoms that could arise: chest pain, shortness of breath, and lightheadedness. If you are experiencing those symptoms frequently, ask Dr. Imperial. He should probably help you out. But yeah, talk to a medical professional and just consult with them about that. So here's some other complications. I did mention, or I don't know if I mentioned, stroke and heart attack, which is the restriction of blood towards the brain and heart respectively. Heart failure occurs when the heart can't pump enough blood throughout the rest of the body. An aneurysm is a enlargement of an artery, and once that artery basically pops, there's just a lot of internal bleeding and can be life-threatening, so not good there as well. And then we also have PAD, or peripheral artery disease. Usually it's when blood doesn't really flow outward, usually to the extremities, so like your arms, but most notably the legs as well. So we have a big number here. So according to, this is just a little bit of just numbers, just to get into perspective of how many people are affected by cardiovascular disease. So 17.9 million individuals have died from heart disease globally, which accounts for about 31% of deaths worldwide. So it's a very, very big issue. And again, this isn't just 5 to 10 years, this is just in one calendar year. So to put that in perspective, heart disease is the leading cause of death in the US and worldwide. In 2018, 30.3 million US adults, which is roughly 12.1% of the population, were diagnosed with heart disease. And from these individuals, 655,000 Americans have died from this disease. So, there are multiple behaviors that can contribute to heart disease, but the main contributor is diet. Everyone knows that eating good usually benefits you in the long run, right? So, just to put it in perspective, I know the arrow's a little small, but the arrows on the left-hand side, if it's pointing up, that means that these foods increase your risk for developing heart disease, and if the arrow is pointing down, these decrease your risk for heart disease. So the easiest way is the bottom 3 is good, top 4 is bad. So meats, especially red and processed meats, can contain high levels of cholesterol and saturated fats, which can lead to fatty buildup and plaque if not kept in check. And I'll say this multiple times too. It's not that this is just from the prevention and treatment standpoint and not from the reversal. You can still have these foods. You can still have red meat. I love a good steak. I like meat. And it's kind of hard to take out meat from my diet too. So, but sometimes you have to just keep yourself in moderation when you're eating these foods. And trans fats, unhealthy fats, raise in individuals LDL, which is the bad cholesterol, and lower their HDL, which is the good cholesterol. For me, but when my dad talked to his patients, he would always kind of walk them through what LDL and HDL and the differences between them. So the easiest way to remember LDL and HDL is think of HDL as your happy cholesterol, so it's good. And then your LDL is your lousy cholesterol, which is bad. So you want HDL because it's happy. Yeah, that always stuck with me, so hopefully the 6 of you too. And then excess sugar, so your sweets consumption also has been linked to higher heart disease mortality as well. So as you know, also eating your fruits and veggies are important for your health. Consumption reduces your total cholesterol and blood pressure, but also if you eat more fruits and veggies, that means that you'll eat less of all the unhealthy stuff. If you're just eating all fruits and veggies, then you don't have enough space for all the chips and desserts, right? So more specifically, a Mediterranean diet, which includes a rich plant-based food source with whole grains, has been shown to prevent and treat heart disease. And we'll look a little bit closer to that in our lifestyle prescription. But lastly, unsaturated fats, so things like avocados, some nuts, as well as like salmon. Healthy oil foods, if you consider that, reduce your lousy cholesterol and improve your happy cholesterol. And again, too much of a good thing can be a bad thing, so don't go overboard on eating a bunch of avocados thinking that you'll be really, really good. Unsaturated fats are still fats, so they're still kind of bad, but they're not all bad. Okay, our next cause is a lack of physical activity, which can cause buildup of fat in the arteries. When we think of physical activity, sometimes, especially, we think of running on miles on end, we think of CrossFit, we think of like the really like strenuous activities. But in reality, especially when we're thinking about cardiovascular disease, it just means not being sedentary. So a good example is, does anyone watch like Netflix or binge shows on TV? You're usually just sitting down, right? Like while doing that. What my grandma usually does when she watches Food Network, she'll put it on and then just like pace around the room. So she's watching whatever cooking show she's doing, but she's avoiding being sedentary. So kind of just changing up small things in your lifestyle could go pay dividends in the long run. Even though it might be just something super small, it can really benefit you. So actually, in one study, someone who was sedentary for about 23 hours in the week had a 37% increase in heart disease mortality in comparison to someone with 11 hours of sedentary behavior, so about half that time. So again, pays dividends if you're moving just even a little bit. Okay, and then another preventable behavior that can lower your risk is tobacco and excessive alcohol use. Cigarettes, chemicals in the smoke can cause damage to critical functions in your cardiovascular system, so your blood vessels and your heart structures could be inflamed or swollen. And additionally, the consumption of 3 to 5 alcoholic beverages per day, raises your blood pressure, and some of these consumers have a 50% higher risk of contracting hypertension. Excellent. And hypertension is one of the risk factors. So it seems like it's really scary because it's a lot of risk factors that are involved, but because heart disease is such broad in scope, there are a lot of things that can affect it. We talked about the first 4, so diet, nutrition, physical inactivity, tobacco use, and excessive alcohol use. So we'll talk about hypertension, so high blood pressure. High blood pressure can stiffen your arteries, which can narrow the flow of blood throughout the body. High cholesterol is another one. Again, high cholesterol, build up of fatty plaque. I feel like I'm repeating myself over again, but a lot of it is kind of clogging up the arteries. So that's high cholesterol. And then diabetes and excess weight can contribute to increased risk of heart disease as well. And then moving on to the last row here, we have stress. Stress is actually, there's a lot more research going on now about stress, how stress can in fact impact your body. And there have been a lot of articles related to how stress can negatively impact your health outcomes, but especially with cardiovascular disease, it can play a very big role. And then the last 3, these last 3, there's not really much you can do about it because it's just, it's just the roll of the dice. Increasing age, everyone gets older, can't really reverse that. Genetic predisposition, if you're born with it or have a family history of it, you are more likely to get heart disease. And then usually if you're male, males tend to get heart disease more often than women.
Why?
Just
Stress.
bad roll of the dice. Okay, so now we're going to be talking about the lifestyle prescription. So we found root causes to better understand how we can get heart disease, but now we'll go into step-by-step lifestyle changes. Excuse me. That can be implemented to improve health outcomes. So when you talk about prevention, we talk about stopping the disease before we even get it. Treatment is you already have it, but you don't want it to get much worse, or you want to just kind of contain it to where it is. And then reversal is, okay, I don't want to have heart disease at all. I'm going to try to get rid of it in the first place. Or not in the first place, get rid of it just in general. So we'll go through each specific step. So next slide. So prevention. Big one, necessity to stop, or necessity to quit smoking, or just better yet, just don't do smoking in the first place. Smoking cessation is the single most effective way to prevent cardiovascular disease. This includes secondhand smoking, which can increase the risk of developing heart disease by about 25 to 30%. And it's recommended just to avoid areas that you can inhale smoking areas or such dangerous chemicals within your means. Again, for moderate exercise, so again, I'll be talking about exercise. Again, you don't have to necessarily go all out in terms of exercising. For moderate, usually a good rule of thumb is if you can do the exercise but still talk, that's considered moderate. So like walking, even gardening. I know that's like a thing that a lot of people do as well. So like picking up mulch and like putting it on the ground. That's still, you're still moving your body. So that's another thing as well. Even dancing, if you like to dance, you can still talk. So it's advised by the American Heart Association to do it 30 minutes a day, 5 times a week, so totaling about 150 minutes per week. And again, that's for just moderate exercise. Vigorous exercise, this one is going to be like your more strenuous activity. So this is like running, cycling, rowing is a really, really good one. It doesn't put as much strain on your body. I like to do rowing. And then this is going to be for 25 minutes for 3 times a week. So roughly about 75 minutes per week. Now you don't have to do both for it. It's just, you can choose one or the other. If you can do both, that's really, really good. Because I don't do both. But yeah, so you can just choose one or the other. Obviously the vigorous exercise is more preferred, but if you can't handle the aerobic activity to do it, moderate should do you just fine. But I would say also, the more important one is going to be your diet. Exercise goes a long way in doing it, but diet is like your crucial point in prevention and then also treatment and reversal as well. So we already mentioned the importance of eating your fruits and veggies. Whole grains are really important as well, and incorporating these foods in your diet can reduce your risk by about 1/3. But how much of these foods should you actually eat? And this is when the DASH diet comes in. Next slide.
Chris.
So the DASH diet stands for Dietary Approaches to Stop Hypertension. And this is a perfect fit for trying to prevent heart disease. So not only is it proven to reduce biomarkers associated with heart cell damage and heart strain, but it's realistic. For some, completely eliminating some of your favorite foods, like sweets or red meat specifically, is almost impossible. I know, like my mom and my dad, they have a sweet tooth. They also love red meat, but they also, they want to better themselves in their diet, right? So this is a perfect example of what you can do without eliminating the foods that you enjoy eating. So it gives them the chance to enjoy the foods and can eat in moderation while also focusing on the important food groups. So important ones to note are the 4 to 5 servings of fruits, 4 to 5 servings of vegetables, and this is per day, and then the 6 to 8 servings of whole grains, an emphasis on whole grains per day. And one thing to note is a lot of it says per day, except for, so this one says per week. But also this one says, this is sweets. This one says per week. So don't think like, I can eat 5 servings of sweets per day. No, this one's per week. So just make sure whenever you're
What is a serving size?
Serving size, yeah, that's a good question. So typically when I think of serving size, now this could be different for different fruits as well, but I think of it like a fist. Is that what usually you go by? Fist is usually like a serving size.
But like, I think when you're talking about fruits and vegetables, it's actually like a half an apple. I think it's
Yeah. So usually like for.
So if you eat a whole apple, that's 2 servings.
Yeah.
Just so you know, like if you're getting a salad at Salada, that's probably 4 servings of vegetables.
Yes, and usually when you order like a meal from a restaurant, they usually go overboard on like the portion size. So I would kind of just work out the math.
So we have this little that you guys can grab later. I think Rachel printed out some better copies. It's the DASH diet, and it's a little flyer. And inside here there are serving sizes, which is really helpful, I think, too.
Yeah, and it's a perfect resource, especially because I even like kind of forgot. Yes. Question there.
This is not a joke question.
Yeah.
Does drinking a beer count as a serving of grains?
That's a good question.
Is a beer a serving of grains? I don't know.
I don't know. That's a good question.
Chris said, Dr. Imperial said no.
Well, tell
Is
us
that-
about its arm trip some more after this is over.
Because
That's
technically
sort
it
of
is.
like asking if eating a cow is eating grass because the cow ate grass, right?
No.
Because I mean, it does have wheat, barley, or rye, so I guess it does. But
Sugar content too.
yeah, it also
Yeah, okay.
it could have sugar. So I mean, it could split between two.
I have a question.
Yes, ma'am.
I make homemade applesauce.
Okay.
So is that considered a fruit or a dessert?
No, that's a, do you put sugar in it?
A little bit, just a very little bit of sugar.
It kind of depends on what you put in the applesauce to make. If it's just apples and a little bit of sugar, then
Yeah.
it kind of, you would probably skew it a little bit to fruits. But again, I would count a little bit of the sugar as not necessarily a serving. Kind of depends on how much.
So, and it says on here that canned fruit, the serving size is a half a cup. So it's a little bit less than, like if you were gonna eat like a half an apple. Or an apple, okay?
Cool. Any questions before I move on? I know I've been talking a lot for
It
fruits and
just
stuff.
seems like
Yes, ma'am.
it's less than 6 servings per day of meat, poultry, and fish. That seems like an awful lot of food.
6 to 8 servings per day. And then this is just a recommendation. You don't have to like eat up to. If you eat less than that, that's totally fine as well. It's just a kind of like a marker if you're trying to portion out your ingredients. And this is just like throughout the day, because if you think about, let's say, breakfast, lunch, and dinner, if you go 2 servings of rice, that might just be like a scoop of rice like per meal. For, let's say, a serving of cup of rice is 2 servings, correct? If you do that for 3 meals, that's already 6. If that makes sense. I don't know if I explained that really well. Yes.
Okay, you have 8 categories there, and are we saying you should eat each one of the 8 categories a day, or pick 2 or 4, or what?
So, if I were to break down which one is the the 3 most important, I would go with veggies, fruits, and then grains, and then you can portion out the meat, and then also like the dairy products, and then some of the oils, because these are kind of just I think of them as auxiliary categories, especially the sweets. You don't really need to eat sweets every day, or even every meal, especially with like the nuts, seeds, and legumes, and then also with like the dairy. Like for me, I don't eat a lot of dairy. Sometimes cheese, I like a cheeseburger, or just like a couple cubes of cheeses on the day. So again, if you're hitting the servings less than the allocated ones listed, that's totally fine.
Okay. Back to the grains. If you like oatmeal, or if you like post toasties or shredded wheat, does that count as a grain?
Yes. Yeah. Anything oat related, that's usually going to be counted as a grain.
And just a reminder, so the serving size of cereal is 1 ounce, so you might eat 2 ounces in the morning, so then it's like 2 servings. So I think you'd be surprised when you start looking at the serving sizes, how small they are.
Pretty
And-
small.
You want me to fold any of those?
Cool. All right. So next we're going to move on to treatment. So treatment plans are for individuals who have heart disease and are looking to manage it. And most of the recommendations are going to be overlapping with prevention. So exercise is needed to avoid complications. Again, it doesn't have to be completely a strenuous activity, but as long as you're not maintaining that sedentary lifestyle like I mentioned previously. So choosing alternatives like taking the stairs if you can instead of taking the elevator, opting for a standing desk instead of sitting down all day is something really important too. So a lot of these simple activities can add up in the long run. Again, diets within treatment are slightly more restricting when compared to prevention. So for someone experiencing heart disease, they don't really have the luxury to splurge on the unhealthy foods that they used to consume in the past when they didn't have heart disease. But yeah, to reiterate from a point made previously, diets higher in plant foods and lower in animal foods were associated with a lower risk of cardiovascular prevalence and mortality in a general population. Okay. Yes.
You say added sugars,
Yes.
what, artificial sugars, is that okay?
No, so added sugars would be like artificial sugars, like something added, and so I'm trying to think of Mr. Butler, you have an example of added sugars? Added sugars?
Artificial?
Yeah, artificial or added sugars.
So, putting sugar on your cereal.
How about honey?
Or honey. Anything that is sweet is considered added sugar. So, honey,
How about Ensure, isn't that one of the,
well, it depends if your Ensure has sugar in it or not.
okay?
So some of the Ensure has sweetener instead of sugar. So you need to make sure you look at your bottle and see how much sugar is in it.
But sweetener is not considered a sugar.
Right, because it doesn't add to the carbohydrates.
What about agave, the cactus sugar, the sweet?
The agave, do you know anything about agave? I think it depends on if it adds to the carbohydrate. So if it says on your agave package that there aren't as many carbohydrates, then it's probably better. I don't know about agave.
Yeah, on your food labels, like Mr. Imperial said, they'll have specifically in like added sugar like section, like right below your carbohydrates, so you'll see if you have that available. See that?
Yeah, so this one has fruit juice in it. And so it has 120 calories and it has 32 carbohydrates, 29 sugars. Okay, so not a good thing,
Wait a
even
minute.
though it's in our little refrigerator here.
What is 29 sugars? What does that mean? Is that one
29
Grams.
grams.
Okay, how much is one serving of sugar?
Teaspoon.
Yeah, about like I would say a teaspoon. I don't know. I actually don't know how
Yeah,
how that's, how
it'll
much
say,
is
it
weight.
should say on there.
Does it?
Does it have sugar on there, Will?
Sounds good.
It doesn't, does it? I'll look it up for you, because I have it written down somewhere. Let's see if it's on one of these other ones. We have some other diets too.
So if you, for instance, back to cereal, if you're eating cereal, if you look at the package, some cereals probably have some sugar added to them.
Yes.
I can guarantee you that a lot, especially the
Sugar frost.
like the kid cereals, like Lucky
Cocoa
Charms,
Pops,
yeah, Cocoa
yeah.
Puffs, like all those are
But,
definitely has added sugar.
So how do I relate what it says on there to how many teaspoons of sugar it is?
Well, just look up a teaspoon of sugar, see how many grams that is, and then you see how many.
Okay, so it'll say on the package
Yes.
how many grams of sugar is in
Because
It'll say
per serving.
Yeah, per serving.
per serving.
Yeah.
So let's say if they count like a bowl of cereal as like 30 grams of sugar in the let's
Okay.
just say that's the serving size, and then
Okay.
you look up the amount of teaspoons is per serving, you can kind of like calculate what
Okay.
that's going to be. Off the top of my head, I'm not exactly sure what that is.
1 to 2 teaspoons, what Google says. It's
Okay.
serving size.
Okay. 1 to 2 servings. And does it say how many
1
grams that
to 2
is?
teaspoons of sugar.
Does it say how many grams
Does
that
it
is?
say how many grams of, how many grams is in 1 teaspoon? Something I should know as a nurse.
It just says 5 grams or less is what you should have.
Per serving?
Is it, how many grams are in a teaspoon?
5 grams in
Per
it.
day?
5 grams in a teaspoon?
Oh, no, that's not right. Are you guys talking about agave?
Or is it
No,
just?
well, we
No, we're
were.
talking about sugar.
Sugar, regular sugar.
Oh, 12
But what would
teaspoons
you-
is
what did
50 grams.
What'd you find out
12,
about
okay,
agave?
so 12, you said 12.
12 teaspoons is 50 grams.
So 5 grams in a teaspoon?
6 teaspoons is 25.
Yeah, so there's a lot of sugar.
Do you want a quick thing about agave?
Sure.
Agave actually has more calories than common table sugar. Has 60 calories per 3 teaspoon serving as opposed to sugar's 48. It can lead to obesity, type 2 diabetes, heart disease, and tooth decay. But it is natural. It comes from the agave plant. It does have a lower glycemic index than sugar, and it has riboflavin, vitamin B12, vitamin B6, folic acid, and vitamin K. But
So just use it sparingly like you would sugar. Use it
it's
sparingly.
still a sugar.
Mhm.
And again, with like added sugars and adding stuff to coffee or your foods, moderation is always the key. You don't want to go overboard. Even though it might be a healthier option with whatever you're using. Like you mentioned your applesauce, right? Even though it might be healthier than store-bought, again, can't be like scooping up applesauce all day. So yeah. And then so.
Now, 50 grams it says is your recommended. That's like on a 2,000 calorie diet a day that, you know, a lot of people do. That's considered about 12 teaspoons. But you have to think about teaspoons is in your fruit that you eat. And,
Yes.
You know, you have to add those 10 teaspoons up for everything that you have all day. So that's not a lot of sugar.
Yeah, basically that 29 that you were talking about, you already had half.
Mm-hmm.
Yeah.
And if you think of, I know bananas have like high sugar, so
Yeah.
even just eating one banana might wipe out like,
Your whole day.
your day of sweets. So that's also something to consider, right? If you're eating your fruits, your veggies, you're still gonna get sugars from other sources, not just from added sugars. That's why added sugars is like you should. This is again for treatment, right? As I move on in the presentation, it's going to be like more restrictive in your diet. So preventative, like we're being a little lax. You can splurge here and there. But now treatment, you have cardiovascular disease. Now you're kind of watching what you have. So instead of putting like stevia or like sugar in your coffee, you might consider drinking black coffee instead. And then moving on to like regular medical checkups. A major component of treatment is monitoring. So working with your medical professional, and you should know exactly, both of you should know exactly where your cardiovascular health is. Is it getting worse? Is it getting better? And this can be determined by having regular medical checkups, getting your blood pressure checked, having your cholesterol screenings, and ultimately it's important to know that everyone has a different goal, and something that works for one person may not work for you. So it's kind of important to have that dialogue and kind of work together to ultimately achieve what your goals are as an individual, right? Because some people may think, okay, I want to reverse my diagnosis and really go all in on an all plant-based diet, and then someone else might be, I don't want to do that. I kind of just want to maintain myself in this spot right now. Okay, and then so next slide.
Oh,
I don't know. So graph's kind of complicated. I'll go into that in a bit. But so for complete reversal of heart disease, there needs to be an intensive lifestyle overhaul that needs to be made if you really want to like reverse and get rid of your cardiovascular disease. So rather than playing defense of treatment of preventing heart disease or even getting it from the first place, you're going on the offensive side and saying you're going to the root causes and saying, I'm going to change this, I'm going to change this in order to reverse those symptoms. So according to a study by Dean Ornish, he targeted 4 things to eliminate and reverse heart disease. So one was switching to a 10% fat, whole foods, vegetarian diet. That's a very big mouthful, but basically an all plant-based diet. And thus eliminating the negative outcomes of meat consumption. Next is having consistent moderate aerobic exercise. And again, the moderate exercise was just walking, taking the stairs, gardening, doing something that keeps your blood flowing, but again, it doesn't have to be super, super rigorous. And again, that's for 30 minutes a day for 5 times a week, so totaling 150 minutes per week. Another one is smoking cessation, just stopping smoking. And then again, this is a big one as well, is stress management, and also like group psychosocial therapy. That was like another added component, but basically just reducing your stress, stress levels, because that can affect hypertension, can affect diabetes, obesity, and other myriad of problems as well. Okay, so for the left-hand graph, this is talking about stenosis of the artery. Stenosis just means closing of the arteries. So if you have higher stenosis, that means that your blood, your arteries are have less blood going through them. So there's a study that was made. The control group was essentially just a group that didn't have any treatment at all. Is the lighter colored red line on the circle. So over from baseline, which is like 0.0 to 5 years, they noticed an increase in stenosis, so meaning that their blood arteries got closer together. So less blood flow, right? But with the treatment group of all the things that were listed here, so plant-based diet, aerobic exercise, smoking cessation, and stress management, all those things, they actually saw a decrease in stenosis, so their arteries opened up over 5 years. So I think numbers-wise, there was an increase of 11.8. So they're essentially 11.8 increase with a 3.1% decrease. So again, better outcomes for the treatment group with that. And again, the biggest impact of them all was strictly a plant-based diet. And then we're gonna click to the next slide.
Which we have here too. We have plant-based diet here too, if anyone wants to take one of those as well.
Okay, so this is a picture of a coronary angiogram for an individual who has heart disease. So you can kind of see, like right here, there's like a lot of like folds and kind of, I guess, crimps of the blood vessel. And when you think of a blood vessel, you think of like a tube, right? Like a straight, long tube. But you can kind of see that there's going to be a lack of blood flow, especially here, just because there's a narrowing of the arteries. And just with just 32 months, so about 2.5 years of just doing a plant-based diet, we see this. And then next slide. Now this is the same. This is the same area, right? You can see that this is the same. This is the same. And even the shape is the same, right? So we know this is the same person and not just another random person. You can clearly see it looks like a healthier artery, right? There's not the folds anymore. This actually looks like an artery. You can see the better blood flow. And this is just from a plant-based diet. And it's also worth noting too that they weren't on any medications, like to lower the cholesterol. It was just diet. Now, it's easier said than done, right? Going from just a regular diet to like a strict and plant-based diet is going to be tough, but it's still doable. So that's just something to keep in mind. The next slide. And this is basically what I'm going to end on. This is a quote from Dean Ornish, who did that study. He's a physician, researcher, and professor, and founder of the Preventive Medicine Research Institute. So I'll read it out for you guys. So heart disease and diabetes, which account for more deaths in the US and worldwide than anything else combined, are completely preventable by making comprehensive lifestyle changes. And then big underline, without drugs or surgery. And I think this is such an empowering statement because sometimes there's this feeling of helplessness or despair, especially when you get diagnosed or like as you get older, like looming like health conditions kind of arise. And sometimes we think to defaulting to medical treatment, especially relying heavily on medications. But if we make the correct lifestyle decisions early on, or even when we're at that stage, we can change that, right? And we can learn not to only manage the chronic disease, but prevent it from becoming a problem in the first place. And from those currently suffering from it, there's always a chance of reversal, as we knew from the last slide. Yeah, that's my presentation. Thank you for having me, and hope you guys learned at least one thing
Yes.
today. So yeah, and these are just references from the slides, but yeah, that's about it. Any questions? Yes.
I have one.
Yeah.
It seems that obesity seems to be increasing instead of decreasing.
Yes.
So do you see a lot more heart disease because of this?
Yes. So that slide. So full disclosure, I made this when I was in my master's program, and this is in 2021. I'm sure that number of I think it was the 3.1 million is probably a lot higher now too, because we see, especially this is 2018, and that's a long time
And
now.
that was before the pandemic.
And that was-
I think
yeah.
the pandemic had a lot of negative effects for people on staying in their homes, working from home, doing a lot.
Thinking about stagnant lifestyles too, because there weren't a lot of people moving outside, kind of just staying indoors, just watching Netflix.
Gyms were closed.
Gyms were closed, yeah. So that I would assume that this number is way, way higher now. And even in Texas specifically too, Texas does a pretty not great job of obesity and diabetes. So that number has just kind of skyrocketed. And I think I forgot if it's the World Health Organization or another organization. They have what they call is Healthy People 2030, and they usually do it every decade. So they had Healthy People 2020, and they had targeted markers of we hope that this percentage of Americans have heart disease, so they want to have a downward trend, but they actually saw like an increase in cardiovascular disease, obesity, hypertension, all of the bad things. So things aren't going in the right direction. Hopefully we can change that. Yes.
What about some of these supplements that you read or see on TV, like the collagens, the plant-based collagens, and it's supposed to be heart healthy and all that? Do you have any thoughts on that?
I'm not exactly sure on collagens, specifically or like the plant-based supplements, but again, if you're looking to reduce your risk of developing cardiovascular disease or just even trying to treat it, plant-based, just removing small things, like instead of eating, let's say if you eat red meat 5 times a week, reducing it to 3 still goes a long way. You're still changing your lifestyle for the better, you're not making it worse. So I don't know if I answered your question, but I guess for supplements, it's a slippery slope when you get to supplements, just because sometimes, kind of like prescriptions, you kind of rely on the supplements and use that as a crutch. Well, there are bigger, I wouldn't say worse, but bigger problems that you could fix in comparison.
What about brain health? Fats are supposed to be good for your brain. So how do you equate that and keep your heart where it should be and still be able to?
So again, there are healthy fats, so like the unsaturated ones, so like
Okay,
avocado.
unsaturated.
Yeah, so unsaturated. So unsaturated is like when you think of healthy fats, so avocados, big one, salmon, that's another one too, some nuts as well.
Nuts,
Yeah, nuts are a good source of healthy fats. But you want to avoid like trans fats. That's probably your worst one. So lean towards the unsaturated.
Olive oil, sardines and olive oil.
I think olive oil is like moderate. If I'm okay, moderate.
Yeah.
It's like it's kind of in a not gray area, but it's borderline. Again, don't use too much olive oil, but
Sparingly.
Yeah.
Okay.
How will?
yes.
There was no mention of salt in there.
Salt. I think I very briefly mentioned it, but salt goes with hypertension. So if you have a lot of sodium, that increases your risk for hypertension, which can increase your
It
risk.
doesn't give you how much you can have a day or so.
Does it?
So that would be here
would be
in
in the
this
dash.
DASH diet, because this
Yeah.
actually is for hypertension. This diet is for hypertension. So that should be in here for you.
Yes, it is.
Okay, good.
Okay, all right. All right.
Yes.
You mentioned Ornish a couple of times. I have a friend who's a big guy. I haven't seen him for 40 years now, so I don't know what's ever become of him, but he was about 6'6", about 375 pounds. Not fat, just big, you know? And he had a stroke. And he got Dean Ornish's book, Reversing Heart Disease. This was like 45 years ago.
Mm-hmm.
And he religiously went on that. I saw him a few months later. He had lost 65 pounds. He was off blood pressure medicine. He was off cholesterol medicine. And three things: blood pressure, cholesterol,
Probably any
diabetes. He was diabetic. So he was off all three. But he said it's not easy. Dean
Yeah.
Ornish's diet is not easy.
Yeah, it's not easy, but again, he was able to do it.
But
Right?
it reversed his heart disease.
Mm-hmm. Yeah, so half a cool story right there. So I mean that's really good to hear because, you know, again, like I said, a lot of people kind of use medications as a crutch to kind of go through the disease. Like, oh, I have it, kind of just default to this is what it is now. But it's ultimately up to you if you want to do that, right? It's your life, you're gonna live it. So it's kind of just if you want to go through, if you want to completely reverse it, again, that's your prerogative, but also just kind of managing it to make it not worse is also a good option as well. But you just don't want to get a worse condition.
What about irregular heartbeat? Is there some dietary or exercise or whatever that could affect that? Or is that a neurological thing you can't do much
Right,
about?
default to the doctor.
Yeah, I don't know about as far as, I mean, obviously avoiding things like stimulants, like caffeine and things like that could trigger an irregular heart
Okay.
rhythm, but as far as other things in the diet, mostly just good heart diet, you know,
Okay.
would be recommended just to help your heart work better. But as far as directly affecting the arrhythmia, yeah, probably just avoiding those stimulants, caffeine, nicotine, things like that.
Any other questions?
What about a stress test to know how your heart is doing? So
Yeah.
you know, do I have a problem or not, or,
Do you do stress
Yeah, so it depends. So sometimes stress tests kind of lead you down a slippery slope. So if you don't, so usually what we'll do is what we call primary prevention or primary screening, where we can look at things like blood pressure, like cholesterol, things like that. And then if there's any risk like family history or something abnormal that shows up with that, then we can go down to the kind of the secondary screening with things like, you know, seeing a cardiologist and doing a stress test. The problem with doing a screening stress test for someone who's no risk, no symptoms or anything like that, is any test that we do have the chance of a false positive. So if you don't have any risk and no symptoms and we do a screening stress test and it's abnormal, then you set yourself up, you have to go down do the next thing. And was that test really necessary to do that screening stress test? There are some other tests, there are a lot other tests that are not as invasive as a stress test and maybe a little bit better, like some blood test you might hear people talk about, like a C-reactive protein or homocysteine. And then there's also a relatively new imaging test where you can do what's called a coronary calcium score. And that's just a CAT scan. So there's some risk as you're getting radiation from a CAT scan. But they can look at kind of your coronary arteries and see if there's any calcifications. So a lot of times when those arteries start showing that plaque that Anton showed, they'll calcify when the blood has been there for a while, and then they can see that on a CAT scan. So that's another screening test that, you know, might not lead to getting a heart cath unnecessarily or things like that.
Anyone else?
Thank you very much.
Thank you.